Hey guys, Dr. Cool here, and I want to do a short video for you because we just had a really cool updated test panel from a patient of ours, and I love sharing results like this. So for our functional medicine coaching programs, my health consulting programs, when we take a patient on, we'll generally do what's called a functional blood chemistry panel. And I would really encourage you, if you want to learn more about that, I have a whole separate video about that on our YouTube channel and on my website, www.drzachcole.com. And so what you're looking at the left here with some of these colors and this page on the left, we run about 6 to 7 vials of blood. It's a lot of important health markers called a functional blood chemistry panel that shows us how a person is functioning from an internal physiological standpoint and looks at all the important markers that relate to their health. So when we get this test back, not only do we run more tests than most doctors do, but as you'll learn in that video, we also interpret the test completely different too, a little bit different. So what you're seeing with these colors here, and again, is broken down more in that video, we are concerned about the optimal range, not just the standard range, but the optimal functioning range for all the test markers that we run. So if a person's labs are out of that optimal range, your doctor may still consider that normal, but we don't, and so that's highlighted as yellow. If something's out of even the standard range, that's highlighted as red. And so what I want to show you here, generally, we'll run a test initially, and then we'll redo that test anywhere from 3 to 6 months later. But this is a pretty cool video because if I zoom in here, hopefully you can see the date for this test that we initially ran was June 15th, 2018. Now, if we go over here to the doctor's new test, in fact, let me zoom out again here, so you can see that her doctor ran updated testing on August 6th, 2018, so not even 2 months later. And we have all the personal information blocked out here, so we're not sharing any personal information. But if we look at just the result of the cholesterol markers here, starting out, the cholesterol on the left-hand side in June was 279. You know, how important is that with heart disease being the #1 cause of death in America to get that under control? And the other thing is that the majority of the medications prescribed, statin drugs, cholesterol-lowering drugs, are make up a massive amount of the prescription drug industry right now. And it seems like nearly every patient we have coming in here who's 40 years or over, a large amount of them are taking cholesterol-lowering medications. So what I hope you understand from this, and what I try and educate all my patients into understanding, is that you will lower cholesterol when you reduce the inflammation in your body. So we have our patients follow an anti-inflammatory, alkalizing, kind of plant-based, real whole foods, cellular healing type of a diet. And when you do that, cholesterol markers and liver enzymes we're going to look at too, they just come down amazingly. So over here on the left-hand side, the starting cholesterol was 279. If we go over here to the right, not even 2 months later, it's down in the normal range here now of 199. If we look at the triglycerides, they weren't in the red yet, but they were getting close to it. They were 106. Triglycerides now came down to 65, so it dropped about 40 points there. And her LDL cholesterol, we're told, is the bad cholesterol. It was 180 to start, and now if we come down here, it's at 119. So she dropped 61 points off of her LDL cholesterol. You guys, the most amazing part of all this is if you're a patient of mine watching this video, you know that I have my patients follow a high-fat diet, the exact opposite of what we're told to do if we want to lower down our cholesterol numbers here. So I'm going to do a whole separate video on this, but there is a major difference between healthy, God-made fats and inflammatory, man-altered fats. So when we eat the right types of fats, when we get on a cellular healing diet, amazing things happen to our cholesterol markers here. If I can flip the page, and we're also going to look at this patient also has some, if you've seen the red here, some significantly elevated liver enzyme markers. So your liver is your biggest detox organ. If these markers start to get elevated, it means the liver is damaged or dying. So as the tissue cells of the liver break down, it releases these enzymes into the blood that we can test. And the higher the enzyme levels are, the more the breakdown occurs. So as you see here, I said we run more thorough testing. We have 3 different, at the top here, the yellow and the 2 reds. We run 3 different liver enzyme markers. Now her doctor for this updated panel only ran 2, so we don't have the 3rd one to go off of quite yet. But these should be in between 10 to 26. The first two, one was 31, one was 74. So the one that was 31 over here came down to 16. So we just about cut it in half. And the one that was 74 is now 24 and also down in the normal range, both those over here. So 16 and 24, they used to be 31 and 74. Those are the two liver enzyme markers, AST and ALT. The cool part about how all these tests tie in together is that your liver is your biggest producer of cholesterol. So as the liver heals, your cholesterol markers will heal. I hope you take away from this that everything ties in to everything. That if you want to get your cholesterol markers lower, you cannot just take a statin drug and think that's going to fix the problem. It may temporarily, artificially lower it, but we want to heal the underlying root cause of why it's elevated in the first place. So hopefully this was really helpful in showing you the possibilities. Again, less than 2 months, these numbers are now all in the normal range here. So if you have some cholesterol issues, or if you have some heart disease issues, or if you're looking to take a natural approach to your health, call our office 724-237-5299 or visit our website at www.drzachcole.com. Thanks a lot. Have a great day.